I'm Anna Gideon Kasililika. I'm a medical doctor and a reproductive biology scientist. I'm from Tanzania, Dodoma. Dodoma is the capital city of Tanzania. I work at Benjamin Mkapa. As a reproductive biology, I've been working in establishing assistant reproductive unit, and I've been recommended by an alumna who came for MAHE training, and that's how I got it. And the good thing is that our government, Ministry of Health, has a partner with the MAHE, and they selected among the people who applied, and so that's how I got to get the position here. The fertility care right now is still at the baby step in Tanzania. This can be explained by we have a very few operating IVF center. Most of them are located in a commercial city, that is Dar es Salaam and Arusha, and they are private owned, and we don't have any institute that is providing training in embryology in Tanzania. But there's something good news is that government hospital, 3 of them, they're in the process of starting offering IVF services, and that includes the hospital where I am currently working. Okay. Like I said earlier, is that we have very few fertility experts and embryologists, and we have very limited number of IVF centers. Most of the patients with infertility are being treated by either clinician, medical officer, or a gynecologist, and there is also no assurance of what services they get. And most of them, I'm glad that this year I did a research. I found most of them that are being given ovulation induction drugs. That is mostly they get. And for very few who are able to go to the hospital, I mean to the private centers which are offering IVF, then for them they can even get intrauterine insemination, or they can get IVF, but there is no in vitro maturation or other very advanced fertility treatment. As a reproductive biology specialist, I feel that this training has been an eye-opening for me, and because it has given me a best knowledge. I've been taught by an expert lecturers, professors from India, from some of them were coming from Germany, and this has been a very great opportunity because these people, I mean my professors, have experience of more than 20 years. Now you can imagine the knowledge that I've been having right now. I'm so grateful for this opportunity, and I'm sure that with this opportunity, with this knowledge and the practical skills that I've received, I'll be able to deliver good care, fertility care, that is caring the gamete and embryo of the patient that I'll be taking care in Tanzania. And last but not least is that I like learning and share the knowledge that I have to other people. So from what I've learned, I also share with other health professionals in Tanzania, and hoping that we'll be able all together to take good care of the people with infertility. The perception is that women with infertility are facing like social stigma, and this can be explained by the way how, like, I have some of the patients that I've been seeing is that they would tell that they had history of being divorced, not because they choose, but they had to get, okay, not divorced, it's like separated from their partner, not because of their own will, just because they couldn't give birth, and the whole society looks at them like, why are you not able? And if you're not able, then you have to give the space to another woman to do it. So in addition to that is that infertility is that it does not be considered like kind of a disease, and that everyone can give you an opinion. Like somebody could, a woman with infertility can be advised maybe to use a herbal medication. And I've seen some patients who have been using herbal medication. They try to insert it through their internal reproductive organ, which caused some burn, like it was a worse situation. But that is because of the poor knowledge that these people are having, and that any drug being offered to them, any treatment, they're ready to take them. The major challenge of fertility in my country, I would say that infertile women is being contributed by ovulatory causes. Some are uterine causes, some are tubal causes. And I'm glad that I did a research which is published, and I found that some of the fertility causes might be the social life. Like most of the people get married at the older time, and for us women, we are supposed to, there is a reproductive age time. So once you pass that, then for you to conceive become a hard time. So I think those are the kind of a challenge which the women in Tanzania are also facing. So the awareness of male infertility is still low. And this I can tell it by the fact that most of the patients, not most of the people, will just say that they think that being able to ejaculate means that you are being able to fertilize, when in reality that is not the truth. Even here, I've seen a patient will come, you get a sample with semen, but you'll not find any sperm. So I think this is a good opportunity also for me, like explain to the people, so is to improve their awareness that male infertility is there, and that they need to, once they see that they have problem, then they should go to the hospital so that they can have good care. So our training is a 3-month training, and within that time we were divided into groups, and into those groups we are being located either in andrology or in embryology or micromanipulation or ART, that is the clinic. So from there I've been acquired a lot of skills from the lab setup, how to practice good laboratory practice, how to do semen analysis, sperm preparation for IUI, sperm preparation for IVF. I've also learned how to prepare the dishes, embryo culture, doing ICSI, and cryopreservation. Something else, we had a very opportunity to have to being trained by a visitor from Germany, who taught us about in vitro maturation, which is a very new upcoming ART treatment. So this was a very good opportunity. So I've learned a lot, and actually this field is learning. The assisted reproduction field is it's like a learning field. The learning is not ending. So I'm glad that I get opportunity to learn even what is going on the other side. People are now doing in vitro maturation. People are now doing genetic testing, pre-implantation genetic testing. So before I came here, I had a motivation that I should share the knowledge of my reproductive biology knowledge to health profession in Tanzania. So I organized a training session. I've been organizing training session with IVF centers in Tanzania. So I feel now that after receiving this knowledge, I'll continue working on that area to ensure that the knowledge now that I've gained, I also share with them, because I believe this is the best knowledge, like how you care for the gamete, how you care for the embryo, and not only the gamete and embryo, but also involving the patient in every step of deciding what should we do to this embryo. That is because I've learned from from the clinic here, what they do is that at every step, the patient is involved. The patient is being asked what is this a suggestion, and so they can make a better choice. Not like the hospital has to do everything on their own. So that is something also I've learned. I would like to thank Merck Foundation More Than a Mother for giving me this opportunity. This is a very great chance. So I would like to say thank you, and we say Danya Vat, Asante Sana, welcome to Tanzania.